Hello folks, welcome back to your favorite YouTube channel on medical education, TutorMed. Indeed, medicine is simplified here. We will continue with our exam-oriented learning on the OSCEs. Unsubscribed viewers, kindly subscribe and hit the notification bell and then be among the first to be notified when new videos are uploaded. If you've got any questions, kindly leave them in the comment section below. Ready? Let's begin. Quickly, let's begin with the general examination station. Remember the strategies we explained in the previous video? We said to use two broad strategies. And so one, you practice and write out templates. Now you are practicing the skills and then you are writing out templates on how to present your findings, typically in a minute. And then how to present your answers when you are asked. And then next, you learn relevant cases first. Some of the cases you should master for this station include chronic liver disease, lymphoma or leukemia, pulmonary tuberculosis or tuberculosis in general, nephrotic syndrome, chronic kidney disease, rheumatoid arthritis or gout, sickle cell disease, retroviral infection or HIV and AIDS. This list is not exhaustive, but what I mean by mastering these topics is that you know the signs to pick on examination, you know how to investigate them, and you know how to manage them, because these are the questions which are going to be asked. Now for the general examination station, this is how the instruction will be. Typically, perform a general examination on this patient. Then the cardiovascular examination station is still the same two broad strategies. Practice the skills and then write out templates. These templates are like songs. You sing the song every time for the lyrics of those songs to be part of you. Because remember, you have 10 minutes within which to present your case and to answer questions, aside examining your patients. And so for the relevant cases to note for this station, number 1, heart failure. You cannot go to a cardiovascular station without reading on heart failure. Number 2, heart failure. In fact, number 3, heart failure. Heart failure is very important to read on before going to the cardiovascular examination station. And the 4th case, atrial fibrillation, then infective endocarditis, rheumatic fever, valvular heart diseases like mitral regurgitation, mitral stenosis, aortic stenosis, and then hypertension. And so typically, for this station, the instruction would be examine the cardiovascular system of this patient. Alright folks, and so we move to the respiratory examination station. The same strategy, I cannot overemphasize it. Practice the skills and then write out your templates, the lyrics of your song. Write out templates and then practice those lyrics. Then here the conditions to be familiar with. 1, the pneumonias. And then 2, pulmonary TB. 3, pleural effusion. I'm tempted to bring pleural effusion ahead of TB, because more often than not, pleural effusion features commonly. Then the 4th case to note here is COPD, chronic obstructive pulmonary disease. So typically for this station, the instruction is examine the respiratory system of this patient. Alright folks, and so the next station is the gastrointestinal examination station. Skills, templates. Practice these two. And then for the relevant cases to note for this examination station, number 1 is chronic liver disease. It's a must know. Can you guess the second condition? Number 2, it is still chronic liver disease. Number 3, chronic liver disease. And then sometimes a candidate may just pick splenomegaly, and so he may be asked for differentials of splenomegaly. And then based on the size of the spleen, how low it is from the left subcostal margin, you can have mild, moderate, and then massive splenomegaly. And usually what I use, some school of thought thinks that moderate is from 4 centimeters to 8 centimeters below the costal margin. And so if moderate is 4 to 8, then mild will be less than 4 cm, and then massive will be more than 8 cm. And so when you pick splenomegaly, after you have graded it as mild, moderate, or massive, then you may be asked to give differentials. So typically for this station, the instruction is examine the gastrointestinal system of this patient. And so we turn our attention to the neurological station. Still skills and templates. Practice your skills, practice your templates or your lyrics. And this is one of the most difficult stations in the OSCE because the examination instructions can vary. And then the steps in the examination appear cumbersome. And so one of the instructions you can be given is, please examine the lower limbs of this patient neurologically. Once you hear this instruction, then the most likely case you are going to discuss is differential diagnosis of paraparesis or paraplegia. And so conditions like Guillain-Barré syndrome, Port's disease are must-knows. You need to know these two conditions. Then another instruction, examine the motor system of this patient. And very likely you are going to meet one half of the body weak, and so hemiparesis or hemiplegia. Then straight up, you know you are going to discuss strokes. And so infarctive and hemorrhagic strokes should be known inside out. Then the third instruction can be, examine the face of this patient. Hello, 100% facial nerve palsy. You are going to discuss facial nerve palsy. Although some of the times, or in some cases, the nerve palsy here is oculomotor nerve palsy. But even for that case, you may be asked directly to examine cranial nerve 3. But once you hear examine the face of this patient, more often than not, facial nerve palsy. Then the last instruction can be, examine the gait of this patient. Then we are going to discuss Parkinson's disease. You need to know inside out. You are going to discuss maybe cerebellar conditions. You also have to know that inside out. Alright guys, and so I brought this slide up because I left out 3 important conditions we are to also focus on for the general examination. It is possible to meet a patient with a unilateral left swelling on general examination. And for this, the conditions to focus on are deep venous thrombosis, DVT, and then cellulitis. Again, another condition you should be aware of in a general examination is an anterior neck swelling. And obviously, you need to focus on thyroid disorders, particularly hyperthyroidism and hypothyroidism. The signs to pick up, how to present your case, how to investigate each of them, how to interpret thyroid function tests, and how to manage each of them. And so I will end with this quote again. Remember that in any exam, which is a measure of a student's success, the most intelligent or smart student in that exam is one who has prepared or whose questions was asked during exam, not the one who read books from cover to cover only to forget what he read in the first page. All the best, guys, and see you in our next video.